Toronto Western Hospital's emergency room was at risk of shutting down this weekend due to a staffing shortage. Thankfully, they were able to secure enough last-minute workers to remain open. But those in the medical profession flag this is going to be happening more often, and it's going to get worse.
This is no different than what the rural hospital's been going through. But there are a lot of staff in the GTA hospitals, and for them to call this out, it had to be pretty bad.
University Health Network tells City News in a statement they were in a very tight situation for staffing over the weekend because of significantly higher numbers of patients presenting to the ED, sicker patients, staffing shortages, staff illness, and well-deserved and needed vacation scheduling. Requests were made of all health disciplines to staff shifts, and Team UHN responded so that all areas were covered for the weekend. Healthcare professionals continue to rise to the challenge, but it has been a very long and hard grind, and people are tired. They further add these solutions are short-term, and we are focused on longer-term solutions, including international recruitment, training and deployment of clinical supports, digital health solutions, to name a few. The president of the Ontario Nurses Association, Catherine Hoy, says the situation will only become more dire.
It's terrible. It's worse than ever. I hear they're retiring. I hear they're just waiting for their American licenses to come through. I hear they're quitting. I hear they're applying for postgraduate programs. They are leaving.
Toronto emergency physician Dr. Kashif Brazada says working short-staffed on a constant basis is taking a toll on those in the medical field.
More people will leave the field if you keep pushing them harder and harder. Like I was called into work last week because we were overwhelmed. I stayed up till 5 a.m. seeing patients. I had to work again at 9 a.m.
While he hasn't had to fill in on a nurse shift in the past year, like medical staff have been asked to do at Toronto Western Hospital this weekend, he says he can imagine how difficult it would be.
It can be quite jarring. Like I haven't put an IV line in maybe 10, 15 years, not since medical school. You'd have to train people to do a whole different skill set. And the skill set of a nurse it's a very difficult job. And it's not something you can just pick up right away.
Hoy says if we want to see a change, Bill 124 needs to be abolished, which generally limits annual salary increases to 1% for many public sector workers, including nurses, among other things.
We need to get the international trained nurses their license, because they are registered nurses in their home countries, and they deserve to be working as nurses in Ontario. We need to get the retired nurses to come back and work, some at the bedside, some to support the new hires.
Hoy adds the province needs to work on recruiting and retaining more nurses and finding ways to keep them in their existing jobs. In Toronto, Maleeha Sheikh, City News.